Greetings and welcome to the webinar Global Healthy Workplace Award winner Lincoln Industries 2017. I am Wolf Kirsten, and I am a board member of the International Association of Worksite Health Promotion and also the co-director of the Global Center for Healthy Workplaces. And I'm very glad that today we have an excellent case study that we can present to you from Lincoln Industries, and as I mentioned, they won the Global Healthy Workplace Award this year in 2017. And Greg Howe will present that, but I would like to give you a quick overview and introduction to the Global Center and also, of course, the Global Healthy Workplace Awards and the criteria. So here, just quickly the background. We are based in North America and in Europe, but work truly global. And I guess we could say that the flagship program is the Global Awards Program, which we've been running for 5 years now. We're entering our 6th year. And in addition to that, I'll speak briefly to that at the end of my contribution here, also a certification of healthy workplaces. If you could go to the next slide, please. Here we can see our advisory board, and I'm very glad to tell you that we have 2 IAWHP board members on our advisory board, Nico Pronk, past president of IAWHP, and also Bob Karsh from American University. They've been very played significant roles in advancing the Global Center, and some of you may also know Paul Terry from Hero, and also from Europe we have Pierre Vincenzini and Carl Kuhn, and also Pam Bolton, who works with the NGO. And we're growing this advisory board. Next slide, please. So here you can see in red, Lincoln Industry won the award this year for the SME winner, which is the small and medium-sized enterprise category. And that's any enterprise up to 500 employees. Could be based anywhere in the world, so it doesn't have to be a global company. So it can be as small as 5 or 10 employees, as long as they're running a workplace health promotion program and they're doing it well. As you can see here, our other winners, we had Chevron present, I think, 2 weeks ago in a webinar on their program as a multinational winner. And also we had Gemini from Australia win the large employer category. Next slide. So these are just some of the previous winners beyond this year. As you can see, some pretty good household names, as well as some really small companies which we may have not heard about, which are running some excellent programs in their respective country and region, which is exciting. And just quickly, the way this works, we accept applications, and I'll tell you a little bit about the timing of that on the deadlines at the end. At the beginning of the year, and they come in, they are reviewed, shortlist is developed. And then 2 finalists per category are determined based on the score from our judges, and I'll introduce the judges in a second. And then those 2 finalists get invited to the Global Summit, which each year, as you can see, is in a different country, in a different continent, and next year we'll be back in Europe. And there they will make their final presentation and their case to the audience, and especially to the judges, where they will field some questions from the judges just to determine the final score. And that's where the winner is determined on site. So they don't know when they're coming to the Global Summit if they're going to win the award or not. Next slide, please. This is very important because this is really the foundation or the framework for the Global Awards Program. And some of you may be familiar with the Model for Action for Healthy Workplaces from the World Health Organization. And this has been around for probably, I think, 6-7 years. So it's still, I guess, relatively new. As you can see, it's fairly comprehensive, and I won't go into much detail, but I'd like to just quickly touch upon the 4 areas and the center circle that you see. So the 4 areas: the physical work environment, keeping your workplace safe in terms of occupational disease, occupational risks, all these things which a lot of companies do very well with having an occupational health management system in place. That's really important. At the same time, the psychosocial work environment, as you know, is gaining in significance, I should say, due to the problems that we face: mental illness, work-related stress. So it really touches upon how is work structured, how is your relationship to your supervisor, how is your relationship to your colleagues, and how is work itself? Do you see meaning in work? Do you identify yourself in your work? Is your role pretty clarified? And do you receive adequate awards that you perceive as adequate? So that's really important, because there's a bunch of research documenting the link between work conditions, or quote unquote bad working conditions, and ill health, and that's so important, which I think a lot of companies are just starting to get to the bottom of it, and that's really important, I think. On the right, if you go back to the right, personal health resources, your wellness programs, your lifestyle-related programs, very important, of course, giving the lifestyles that people have these days, unfortunately, moving enough, eating right, and so on, and that's very important as well. And then to the bottom, the role that enterprise plays in the community with regard to health. We know about the environment, and companies have become so aware of what kind of environmental footprint they leave. But what about the health footprint? Do they work together with the community, with the families, of course, dependents? Do they share some of the expertise, maybe with their immediate community? And so those things, that is also scored in this, or also reflected, I should say, in the healthy workplace model for action. And then very important in the center. Well, first of all, the very center, the ethics and values. Then you have your leadership engagement. We all know how important that is if your leaders are fully involved and support the program, and we'll definitely hear about that from Greg. And then, of course, also the worker involvement. You can't forget that. You need to get your workers from the beginning involved and bought in and active in the program. And then you have your continual improvement cycle. And I think most of us are very familiar with that, and hopefully work along those lines. But unfortunately, many companies, with regard to workplace health, do not do that. Still, if you look at on a global scale, so you've got to assess your needs, prioritize, plan, and then of course after implementing, evaluate and showing the outcomes, or maybe process indicators along the way. It's very important to show that, and to then of course readjust and improve, and that's part of the very important criterion of the awards program. So while it doesn't have to be an ROI to show a specific ROI necessarily, we do ask for evaluation indicators and some trend data over years. So they have to show some success in order to win the award. I think that's important to point out. And finally, I should mention that the WHO, who developed this model, and I was part of the working group, but they don't officially endorse the Healthy Workplace Awards program. I just wanted to mention that because they don't recognize employers. So next slide, please. Here we see our judges. Again, we try to be as global as possible in all our programs and strategies and approaches. So you can see 5 continents reflected here in terms of the 5 different judges. And yeah, they're on a rotating basis every 2 or 3 years. Usually they are rotated with new judges, and they all come respected, first of all, and come from unique backgrounds. So it's really interesting group, and they always come together face to face once a year at the Global Summit, but also virtually before that. Next slide. I just wanted to, towards my end of my part here, I wanted to introduce you to the certification. Next slide. So the certification came out of an interest, very natural and very understandable, of companies wanting to receive recognition, although they didn't win the award. They were asking, well, how do we do? What can we do better? Which is, of course, a great question, and we try to respond to that as best possible. But sometimes companies have an excellent program, they just didn't make the final cut, so to say. And so we decided to create the certification, meaning that if they meet certain criteria, or if they meet the threshold, so to say, they will receive the Healthy Workplace certification. But again, it follows the WHO model pretty closely. So if they, just to give you an example, if they have an excellent injury data, a good management system in regard to occupational health, but they haven't really been that active along the lines of lifestyle programs, and haven't been able to maybe bend some of that data or downward curve in terms of obesity and so on, then they probably wouldn't, maybe not receive the certification. Of course, it depends at the end of the day, but they have to follow or cover all the areas that I just briefly mentioned. And this is just a list. Can't go into too much detail of the criteria, but this is a list of the employees that have been certified this year. Still relatively new. Started earlier this year. But some great companies from a variety of different countries. We're really proud of these companies. Next slide, please. And this is, I think, this is my last slide. But here you see the key dates for next year. So let's start with the certification, as I just talked about it. Those are accepted year-round, so they can be sent in any time, and just go to the website, and I'll give you the web address in a minute. So again, they can apply whenever they want, and the good thing is that the companies who get certified are automatically entered into the Global Awards program. So unless for some reason they don't want to, but typically companies want that. There's no extra cost or anything, and they would just be entered into the either the given year when they apply, or if it's after April 2018, which kind of a cutoff point is, then they will be entered for the next year. So next year that would be 2018, and then 2019 if it's after April. For the awards program, again, the awards program is competitive, so it gets scored, and there's only 2 companies per category which make the final, and then 1 wins. So that's competitive, just to clarify and reiterate. So for that, we do have timelines. So in January we open, in April we close. The exact date will be shared early next year, and in September we will have as I mentioned earlier, the Global Awards Summit. And I should add that the finalist presentations play a key role at the Awards Summit, but it's also a conference, so we invite some experts from various countries to discuss and highlight some key issues which affect the workplace. So if you go to the next slide, Greg, would be great. So here you see the links that for the globalhealthyworkplace.org. You see here the profiles. Those are past winners, so that you can get some information on the past winners and finalists, I should say. They're on there too. So that's some great information. Again, from many different countries. So I think that's always exciting to see. And thank you for your attention. And now I would like to pass it on to our headliner here. Greg Howe is the Health, Safety, and Performance Manager at Lincoln Industries. And he has spent the past 10 years building a culture of health and safety. And for those of you, active in the field, I should say, in the U.S., probably have heard of Lincoln Industries before, because they have been recognized nationally by various different outfits, including WellCoa and the Health Project and CDC. So, but I'll let Greg speak about it, and we'll pass it on to him now. So, Greg, please go ahead.
All right. Well, thanks, Wolf, for the introduction, and I'm really excited to be here and be able to talk a little bit about health and wellness at Lincoln Industries and how we've really approached it. I like to title it a culture of health and wellness. I think it really captures what we do, because it's not just about the programs or the benefits or incentives that we have, but really how we've built it into that culture. So I think it's important to start off a little bit just on who Lincoln Industries is. We are a manufacturing company. We are the largest privately held metal finishing company in North America. We started and have grown right out of Lincoln, Nebraska. It's a family-owned operation. We currently now have 5 operation facilities, and you can see just a lot of work that goes through our facilities every single year, and we are just kind of at the top of that small and medium enterprise category with 470 people that are employed full-time here. We are a 24/7 facility, so important to understand, 3-shift operations, and implementing health and wellness strategies into all 3 shifts can certainly be a challenge, and it presents different types of focus areas that we need to address. When you're working with a real blue collar manufacturing type environment that has multiple shifts, they require different health needs. So important to understand a little bit about who Lincoln Industries is, and I tried to put a lot of pictures in of our people and them out there in their workspaces I think it's always important to understand every organization is different, and how do you take this healthy workplace model and make it fit into your organization? Because that's been an important learning piece for Lincoln Industries as we've really built our program over the last 10, 20 years. So what we do and who our customers are is not how we define ourselves as an organization. We really define ourselves as an organization through our beliefs and drivers. All companies have some set of values, beliefs, mission, or at least most companies do, that help drive them, and we're not unique to that, but we do think we're unique in how we actually go about living these in our day-to-day interactions and jobs. And I think a lot of these you're going to see overlap into things that most companies have: productivity, profitability, honesty, value-added service to customers. A lot of those aren't so different than what most companies have. What we do differently is these aren't things we're striving for. It's not a belief and driver unless that's who Lincoln Industries is and really something we're already doing really well. You're going to see there on the left side at the very bottom there, one of the beliefs: wellness and healthy lifestyles are important to our success. This is a really important one here, and we use these beliefs and drivers to help to drive business decisions at our executive level, all the way down to somebody that maybe just started. And having that statement that that's important to our success as an organization really speaks volumes when we're bringing people into the organization and supervisors are looking for guidance on how to lead their team. And we don't talk about healthy lifestyles important to keep insurance costs down or productivity up. We truly just look at it as a holistic approach that it's important to our success as a company. As I mentioned, we are a family-owned business. This is our owner, Mark LeBaron. His father started the business over 65 years ago. And I love this quote from our owner. Too often companies look at wellness as a standalone program, just another benefit. We've fully integrated wellness into every aspect of our culture. And that's really how we've tried to approach health and wellness here, and understanding that if we invest in our people, that's only going to contribute to their success and our success as an organization. So as Wolf mentioned in that model, right at the core center of that is your ethics and values, and it's centered around your leadership and people engagement. Well, those are what I just talked about right there. That beliefs and drivers, those beliefs and drivers, that is our ethics and values. That's at the heart there. And then right from the top with our owner, he really believes that health and wellness is valuable to our organization. And so we've created different ways to support that from all leadership levels. And how do we get people to understand that and care about it? Because it doesn't work if it's only leadership or if it's only the people side. They both have to be there to really make it successful. So a few ways we've done that is, one, an all-company health metric. So we have what we call our playbook, and the playbook is basically our outline for strategy of how we're going to approach and become a growth company and hit our goals. And the people side is a really big part of that playbook. What are we doing to invest in our people? And as that playbook gets more detailed, we get into actual metrics on if we're moving in the right direction with people development. Health is one of those. So we actually use an all-company health metrics that communicated to the entire organization and that they're all tied to, because they see how that health metric is going to connect back to the overall success of the organization. To take that a step further, on our performance evaluations and our individual performance objectives that all people have, we have wellness included on that. So this has been a unique piece of our health and wellness strategy that we've had in place for over 10 years. And what we do is we allow people to set their own health and wellness goals that then becomes part of their annual performance review, which has a direct tie to their merit increase. And so this has been great because we've given people empowerment to set what's important to them, what's valuable, and then we provide them resources from the wellness team and their supervisors on what is an appropriate wellness goal to set. And so we're right from the get-go, at the beginning of every year, getting people involved in setting their own wellness goal. And just getting people to set a wellness goal it can be a big step in moving forward. Active participation in committees. We have all sorts of committees. I'll talk a little bit about those later on. Feedback is really important. So if leadership's not hearing what our people are requesting and what their needs are, then we can't provide that. So we do feedback in multiple ways. I think the best is always face-to-face, but we know that's not realistic with 470 people. So we also have different survey tools that we use throughout the year that help really get that feedback up to leadership so that we can take action and change if needed. Transparency is a huge one. So just making sure everybody understands why we're doing what we're doing and how that relates back to company success. And then I think the last one really speaks volume is walking the talk. We can't be a company that has a culture of health and wellness if we're not walking that lifestyle. It's one thing to talk about it, it's one thing to invest in programs, but if our leadership isn't actually out there showing the way and leading the way through their actions, it doesn't work. So that is certainly an expectation for all leaders. So as you start to look at the 4 different areas in that healthy workplace model, one of those is really the physical work environment and those personal health resources. And what you'll see here as I go through some key areas in our health and wellness program is we don't necessarily drop in one program or one resource that addresses those different areas on the model. There's a lot of overlap, and that's really important because I think that's where you get the most bang for your buck on really changing the culture of health and wellness with an organization. So Healthy U, which is the name of our on-site health clinic, is one of those that has really helped us move forward. So this is a clinic that is on-site and absolutely free to all Lincoln Industries people and their families. It's staffed with a nurse practitioner and a medical assistant, not quite 40 hours, but for our size, 32 hours is plenty. And what's different here is the focus is all on health risk, preventative care, and wellness coaching. Over 65% of our visits are for preventative health. If you go and look at what happens actually out in your community at doctor's offices, clinics, hospitals, that would probably be the complete opposite of your preventative health is going to be a much lower percentage of the type of patient encounters. Most of these are going to be acute, urgent type needs. Because we've changed the level of access where we've removed the cost and we've put it right here on site, we've been able to flip how people access health resources, and it becomes much more on the preventative side, so we can focus on avoiding risks instead of trying to manage disease. Another item that really hits similar to our Healthy U clinic is Healthy U Fit, and this is our on-site fitness center. So as I mentioned, we've got a population that works 24/7. So think about some of those individuals and maybe how they have to flip their schedules and their lifestyle. It might be really difficult to get regular physical activity if you're finishing up your workday at 12 o'clock or midnight, and maybe you don't have any gyms in your neighborhood that are 24/7. Maybe you don't feel like you live in an area where it's safe to go and get a walk in at midnight. Having that access where they can have safe, convenient workout equipment and a facility to do that in can play a big difference in how people are able to improve their physical activity. So really, we've kind of taken that same model, and we've gotten a lot of people that previously probably would not have been focusing on fitness and physical activity to do so because of the easy convenience that they have there. We also try to make sure that people are optimizing how they improve their physical activity. So we do provide personal training and group fitness programs that help move them along to reaching their goals. So in the United States, when we talk about health and wellness programs, we often don't always connect it back to the safety side. Other countries, it might be a little bit different. But for sure in the United States, we often look at it as, well, this is safety and that's health and wellness, or that's OutcomesHealth. Well, what we've really tried to do here is combine that to really look at that. What's that total worker health look like? You know, we know that the body is business relevant, especially when we're talking about manufacturing, people having to come in and do physical labor every single day. And doesn't really matter what industry, because we also know that the healthier an individual is, the better clarity they can have when it comes to focusing on projects, creation, ideas, visioning, all sorts of different things. So it can help in all aspects, regardless of the type of work. So what we do for our total worker health strategy is focusing on a few key areas. And one of those is a daily stretch program. And this is one of the more simple things we've probably implemented here that has had the best results and continued engagement from our people and leadership over the past probably 15 years. And this is simple for all three of our shifts before they start their day. As a team, they walk through the stretch program. You can kind of see an example of the picture there. Very simple, depending on the area. If it's our electroplating department, they have one set of stretches. If it's our polishing department or assembly, they might have a different set of stretches. We also offer massage therapy on site. These are short 15-minute appointments focused on preventing muscle strain and fatigue in the first place. So what we're doing here is taking areas of our organization where we know the physical requirements can be strenuous and tiring and can take a toll, and we make sure that people are getting this proactive treatment on a regular basis so that we don't get to the point where they have that muscle soreness and fatigue. A big part of any new process, any new work area that we bring in or develop is ergonomic evaluations. So we're constantly making changes to equipment, to processes, and when we do that, we always try to make sure we're understanding what the ergonomic implications are of that as well. And then the last piece that really makes all of this work is one of our committees, our environmental health and safety team. And this group is composed of representatives from all operational or operational support areas throughout our facilities. And this is an individual that has been empowered to take on additional responsibility for their coworkers, for their department, to really be that champion of environmental health and safety. So if someone has an issue or a concern, an idea, they always have somebody that they see on a daily basis that they can voice those things to, that feedback to. And right there, they have the empowerment to take care of it themselves, or if they can't, they know they can always reach out to the environmental health and safety departments for additional support. So that's been a really big one, and continues to help drive a lot of change when we talk about a healthy workplace. It's not just all these different programs, but also getting people to understand that there's not a separation between the safety and the wellness. This is one of my favorite programs where we've just got a lot of fun success stories that come out at an individual level. And the program is called Fuel for Performance. And what I was just talking about, it's really understanding the relationship between the psychology, the physiology, and performance. As I mentioned, the body is business relevant, and we know that if we can help improve people's health behaviors like fitness, nutrition, and sleep, they're going to be able to perform better. And when I say perform better, that might not necessarily mean at their job. Hopefully it's better performance in life, whatever those goals are. Maybe they're trying to be a more engaged father or a spouse, or maybe they're trying to become more active in their community or their neighborhood. We want to make sure we're giving people the energy to be able to do that, so that when they finish work at the end of the day, it's not so exhausted and tired that they're going home and plopping down on the couch and in front of a screen, but able to go accomplish those goals that they want. I think one of the key components of this is how the program is rolled out, because individual coaching on fitness, nutrition, and sleep is certainly nothing new. But what we've done here is we've really tried to create a social aspect of it. So again, creating that culture where teams work together to improve their individual health, and then collectively they're improving the performance of their business unit. This has also really helped to get supervisor support on, because not every supervisor is instantaneously on board, even if your owner is walking the talk and showing that support. So this really helps to show why supervisors should invest in the time and effort it takes to help improve individual health. And we do that through just some variety of different ways, through health assessments. We provide weekly coaching and goal setting with the individuals. We do some activity tracking and Fitbit challenges amongst the team, just fun social challenges where they can motivate themselves. Some just friendly competition that takes place. And then on the back end, we actually do measure performance and productivity within that business unit, so that at the end of the program, we can actually show, here's what the health improvement was, and also here's what the performance and productivity improvement was for your line or for your business unit. I think another big piece when we talk about is, how do we encourage engagement here? So a key piece is we look at the community side, all those personal health resources. We can drop in some of the most unique things out there, but how do we really get people involved? And so we do have some really nice benefits and perks that help get people in the door and moving in the right direction. I won't go into detail on all of these, but tuition assistance is a huge one. If we're thinking about personal development and what that does for an individual, that is a big piece. And we also know that long term, that's really going to help with retention and job satisfaction when we can support people through continued education. Paid time to volunteer in the community. So we know that no matter how great our health and wellness resources are here in Lincoln Industries, once an individual leaves work and they're inundated with fast food ads or other unhealthy things that maybe their friends have or their peer group or might be taking place in their neighborhood, we know we have to engage in the community to promote health and wellness as well. And so we really encourage our people to go out, get involved in the community through different nonprofits, their neighborhoods. And to take that to the next level, we have a community connections committee that actually takes applications from our people that they can submit on behalf of other nonprofits to receive a quarterly grant that goes to those nonprofits within the community. English is a second language. We have over 17 different nationalities that work here. We have people from all over the world that come here either as refugees or immigrants or whatever it might be, and English isn't their primary language. So to help them be successful, this is an important piece so that they continue to grow here at the organization, have better communication skills, and really set themselves up for success. Nothing new here, but I think sometimes we overlook the value of financial stability within a population. So that retirement is important. And I think something that's unique here is I believe it's 92 or 93% of our population participates in our 401k. And that is a big deal when you have people making probably on the lower end of household incomes for an employed group. Of course, we provide discounts on health insurance for different outcomes and participation in wellness programs. We know maternity and paternity leave is very important. And then finally, we have a very unique incentive that really encourages engagement, and that's a Colorado mountain climb up a 14,000-foot peak. So if you've heard about Lincoln Industries Wellness, it's almost impossible you haven't heard about this mountain climb incentive that we have. And this is a very unique aspect where we know that people are motivated, and incentives, insurance discounts, gift cards, whatever, can get people in the door. But that only is getting to the tip of it. What we really want is sustained behavior change and sustained lifestyle change that promotes those health and wellness goals for an individual. And so all of our individuals, every single Lincoln Industries person can qualify for this mountain climb every year. And we take our population out to Colorado from Nebraska, and we hike up a 14,000-foot mountain climb as a company. And it's actually rather simple for people to qualify. It is an outcomes-based program. It's a simple 10 points. They reach platinum, gold, and silver by what they can accomplish. You can see the different metrics that we use for the evaluation there. Tobacco plays an important part of that, half the points. And then one of the great things that keeps people coming back every year or trying for it is if you don't hit the platinum goal right off the bat, you can utilize our health coaching resources to accomplish a goal that you set, and then you earn back your points. And so even an individual that might go through the original screening and not qualify, maybe they start at a gold level, if they hit their goals that they set, they can move up to platinum and still qualify for this mountain climb. And what's so unique about this mountain climb is really how it's accelerated that culture forward. So you can see some of the pictures here, and it really becomes a team goal to get to the top of the summit. And if you've ever tried to climb a 14,000-foot mountain, you know it's not an easy task to accomplish. And especially when you're taking 160 people out there to do so every single year. And we continue to see that number grow. And what's great is we empower our people to help each other. So it's set up through, you have a climb support team, you have climb coaches, you have your executive team out there. That first picture you saw of our owner Mark LeBaron is him on one of our platinum mountain climbs. And he's right there climbing up with electroplaters, polishers, people that are working on the plant floor. And that creates a different type of relationship amongst your employee population. And it creates this social attitude, this caring mentality that we're all in it together, and that all of our health and wellness matters. And we've really seen some great success of people going on the climb to accomplish summit for themselves, to going on the climb to help somebody else achieve a summit for their first time. And it's a really cool experience to have. There's just multiple stories that come out of it. And one story that I'll share today is we had an individual that finally qualified for the climb. He had been trying for a couple of years, and he was a polisher, one of our more difficult job tasks that we have. And he finally qualified for the climb, and he was the last one to get up to summit, but we got him up there, and he had a group of about 3 other people climbing the whole way with him, encouraging him, motivating, helping him, keep that positive mental attitude that he could get there in place so that he didn't quit and turn around. He got to summit, and it was just a really emotional moment for him, and he actually had to kind of go over to the side, and he had like tears in his eyes. And he actually got cell phone reception from the top of the mountain and was able to call home to his 2 daughters, and he was sharing that experience with them. And for him, that was such a personal motivation to just keep going forward, because not only was he able to show his two daughters that, when you really put your mind to it and you set those goals, you can achieve them. But then when he got home, there was a great personal sense of satisfaction, because his daughters had invited his parents over, and they had a cake for him that said, "Congratulations, Dad, we're so proud of you." And that is a really powerful moment, because now he's got that emotional connection to what Lincoln Industries has helped provide to him, and how it's helped encourage him and help him grow personally. And now he's one of those champions that is out there motivated and encouraging others, and really keeps that culture going strong. And when you have things like that taking place on a monthly and annual basis, and there's multiple stories like that, the health improvement starts to become kind of second nature, and you start to see some really fantastic results produced out of that. And so here's just a couple quick bullet points, and I could spend a lot more time on the results, but I think you'll get the picture of what happens when you do have that culture of health in place. So we've got 80% engagement of our high risk and chronic condition population, and we know that high risk and chronic condition group can often be the hardest people to get into your health and wellness program. And we're seeing great success on that side. 60% of our population has 0 or 1 risk factors of those 5 metabolic syndrome risk factors I showed on our point system. Our annual healthcare costs are 35 to 40% below regional average going back to 2008, and only 6% of our population are tobacco users. This shows a little bit about the people how they're making progress on some of those health markers. And you can see across the board there, from BMI to blood pressures to glucose and cholesterols, we're seeing really solid results on people moving forward. And that's a key, is they might not be making huge progress, but they're not going backwards. And at least in the United States, that's a big deal, because we've seen the rise in chronic conditions and diabetes and obesity. So even helping people maintain where they're at and not getting worse, in some cases you can consider that a win. So the fact that we're really moving these people forward and even getting them further away from those types of risks is something we really see as a valuable return that we've had from our health and wellness culture. And I think finally, this is the important part of, stepping back from it all, and not just how we do it or the model that we use, but the why, and why we invest in health and wellnesses within our organization. Because not only does it improve health, but it can change lives of people. And I think hopefully the story that I shared with the individual that got to the summit and was able to share that success with his family, that shows, that's a life-changing event. Like, that's a moment that he can look back on 10, 20, 30 years from now and absolutely still has a huge emotional tie to himself personally. So I really want to just thank you for having me on today and being able to share the Lincoln Industries story and how we've really used that healthy workplace model to shape our success and as we continue to go forward. So Wolf, I'll hand it back over to you and let you close out.
Yeah, thanks so much, Greg. Sign me up for the mountain climb. That's really inspiring story, and thanks, of course, for the overall presentation of your very rich, successful program. With the Global Center, we've been privileged to hear these stories from really, not just the U.S., as I showed earlier, from all over the world, and the sharing of it and the exchange is really the mission that we have, and try to make it as I guess user-friendly, or in terms of the data or the approach, the strategies, everything for others to learn from, and in some way possibly to adapt in some way, for the good practices. So So thanks again, Greg, for taking the time and presenting that. As this is a recorded webinar, the Q&A, I just encourage you to contact us, to contact Greg. You can contact me too on the criteria or anything. As you see, the email addresses here. Really appreciate you taking the time to listen. And I should say before I close here that so this, as you know, this is presented by the International Association for Worksite Health Promotion, which is an ACSM affiliate society. And IAWHP is the first global association dedicated to advancing the global community of worksite health promotion practitioners. So, I encourage you to take a look at the website. It's iawhp.org, very simple, with the benefits and programs on it. So thanks a lot. So thanks again, Greg, and thanks everybody for listening. And this is ending the webinar today. Thank you.